root resorbed teeth of poor prognosis. Welcome to this episode of Orthodontics in Summary. Today's episode is looking at root resorbed teeth and is a follow-on from part 1 in our last episode looking at impacted canines, this time the effect to the adjacent incisor teeth. This is based on an excellent lecture given by Julia Naoumova at last year's British Orthodontic Conference and her research, which really reappraises this topic of impacted canines but through the lens of a cone beam CT. And Julia starts off by describing the prevalence of root resorption on incisors from impacted canines. The literature varies, but it's up to 67%. But how does this apply clinically? And that's where Julia's question came in. In a study carried out by Dahlén in 2024, they looked retrospectively at root resorbed incisors to follow up their prognosis. They looked at 27 incisors over a 9-year period. The main outcomes from their research was that survival was at 100% for these resorbed incisors. And Julia got granular with the data, and they looked at, using CBCT data, both the horizontal resorption as well as the vertical. So, when it came to looking at the severely resorbed teeth, grade 3 as it's defined, which is inner dentine not involving the pulp, all 17 teeth survived. Once more, the severe category, grade 4 into dental pulp, into the actual pulp chamber, 12 teeth had this categorization and all survived the 9-year period. What about vertical tooth loss? Well, when it comes to looking at between 2 millimeters and a third of root loss, or grade 3 as it's defined, there were 7 teeth which survived this time. However, there was only one tooth which was severely resorbed, greater than a third. That indeed survived, but it was only one patient. Other outcomes that were looked at were the symptoms. Mobility, ankylosis and discoloration and changes of periodontal health were not affected by the teeth being resorbed. What were the changes like over time? Well, the patients with horizontal resorption, there was no change over the 9-year period on average, with 81% having no difference. Interestingly enough, 15% of patients had an improvement. When it came to vertical loss, it's a different story. Actually, 57% of those patients had a worsening to the resorption, and that seemed to be attributed to the orthodontic treatment which then subsequently followed from the initial observation. And this ties in with the previous research we've had looking at root resorbed teeth. And that includes Becker's study from 2005, Berkland's paper from 2011. But I wanted to revisit Johnson's paper from 2007, where they classified things differently, and I thought it was insightful. They looked at 18 teeth, incisors that had been resorbed, but they classified it as the amount of root remaining. So when patients had less than 10 millimeters of the incisor tooth root remaining, they found that 60% of them, 11 out of 18, had grade 1 mobility. I thought that's a far more insightful way to look at, well, what is the prognosis of the teeth, but defining it by the amount of root structure which is left. Julia Naumova's conclusions were, extractions of asymptomatic teeth based upon root resorption should not be part of routine clinical practice. And I think that's something which I will reconsider in my own clinical practice. Please do subscribe and look forward to next episode.